The President made some comments yesterday on the upcoming Supreme Court Obamacare decision. Referring to his health care law, the President said, and I quote, "What's more, the thing's working." Part of what's bizarre about this whole thing is that we haven't had a lot of conversations about the horrors of Obamacare because it hasn't come to pass, end quote. That was from the President yesterday. Now, let me just repeat and put that into context, Mr. President. The President of the United States thinks that Obamacare is working and that negative predictions about the law haven't come to pass. Well, to respond to that, let me just read a few headlines from the past couple of weeks. This from CNN, Obamacare sticker shock, big rate hikes proposed for 2016. From the Associated Press, many health insurers go big with initial 2016 rate requests. From The Hill, overhead costs exploding under Obamacare, study finds. From the Associated Press again, 8 million health plans, I should say 8 Minnesota health plans propose big premium hikes for 2016. From the Lexington Herald Leader, most health insurance rates expected to rise next year in Kentucky. I could go on. The truth is, Mr. President, not only is Obamacare not working, it's rapidly unraveling. A May 1st headline from the Washington Post reported, and I quote, "Almost half of Obamacare exchanges face financial struggles in the future," end quote. Hawaii's exchange has already failed. California's exchange is struggling to sign up consumers. 1/3 of the consumers who purchased insurance on the California exchange in 2014 declined to re-enroll in 2015. Massachusetts exchange is being investigated by the federal government. Colorado's exchange is struggling financially and has raised fees for consumers purchasing insurance plans. Rhode Island's governor is pushing for new fees on insurance plans to help fund the $30.9 million operating cost of the Rhode Island exchange. Now, incidentally, Mr. President, that's $30.9 million to run an exchange that serves just 30,000 people. The Minnesota exchange was supposed to cover more than 150,000 individuals in its small business marketplace by 2016. So far, it's covering 1,405 individuals, or approximately 1% of the number it's intended to cover. The Minnesota exchange has cost federal taxpayers $189 million so far, $189 million for an exchange that provides coverage for just 61,000 people. A recent Forbes article notes that Vermont's exchange, and I quote, "will need $51 million a year to provide insurance to fewer than 32,000 enrollees, or $1,613 per enrollee in overhead." Now, before Obamacare, $1,600 would have been enough to pay for the entire annual premium for some individual insurance plans. Mr. President, while the Obamacare exchanges unravel, health insurance costs on the exchanges are soaring. Insurers have requested double-digit premium increases on 676 individual and small group plans for 2016. More than 6 million people are enrolled in plans facing average rate increases of 10% or more. Around the country, rate increases of 20, 30, 40, and even 50% are common. One healthcare plan in Arizona is seeking a rate increase of 78.9%. So much for the President's promise that his health care plan would, quote, bring down the cost of health care for millions. In my home state of South Dakota, proposed rate increases range up to 44.4%. Now, that's not something, Mr. President, that South Dakota families can afford. The discussion about Obamacare's success or failure is no longer theoretical. The evidence is in, and it shows that the President's health care law is broken. It's time to repeal Obamacare and to replace it with real health care reforms that will actually drive down costs. 5 years under Obamacare is long enough for American families.